In the high-stakes world of cardiothoracic surgery, a hesitation of 3 seconds can cost a life. But on November 14th, inside Operating Room 3 at St. Jude's Medical Center, Dr. Alistair Thorne, the man they called the God of the Scalpel, didn't just hesitate. He froze, stone cold, with a patient's chest cavity cracked open and an aorta rupturing. The most brilliant surgeon in New York went catatonic. What happened next wasn't in any medical textbook. It wasn't a resident who stepped up. It wasn't the anesthesiologist. It was the rookie nurse on her second day, a woman nobody knew, who reached into the chest of a dying boy and did the unthinkable. This is the story of how Elara Vance saved the surgeon, who was supposed to save everyone else. St. Jude's Medical Center smelled of antiseptic and old money. It was the kind of hospital where the lobby had a grand piano, and the donors had their names etched into marble pillars thick enough to hold up a bank. But the real power wasn't in the lobby. It was on the 12th floor, in the surgical wing, the domain of Dr. Alistair Thorne. Elara Vance adjusted her scrub cap for the 10th time, catching her reflection in the sliding glass doors of the sterilization room. She looked younger than 24. Her eyes, a startling shade of grey, looked terrified. She was a traveller, an agency nurse brought in to plug staffing holes. To the permanent staff at St. Jude's, she was arguably lower than the janitorial staff. She was temporary, disposable, invisible. "Vance, stop fidgeting," a sharp voice snapped. Elara jumped, turning to face head nurse Sarah Jenkins. Jenkins was a 50-year-old veteran with posture like a drill sergeant and a patience threshold of 0. "Sorry, Nurse Jenkins. It's Dr. Thorne. He puts his pants on one leg at a time, just like you," Jenkins said, though her eyes betrayed her own anxiety. "Only his pants cost $3,000, and he hasn't lost a patient in 6 years. Listen to me, Vance. You are scrub nurse number 2 today. Your job is to hand instruments to the scrub one, anticipate needs, and breathe quietly. If Dr. Thorne looks at you, you've already made a mistake. Do you understand?" "Yes, ma'am." "Good. Because today isn't a routine bypass. The patient is Juliana Sterling." Elara felt the blood drain from her face. Juliana Sterling, the 19-year-old daughter of Marcus Sterling, the state senator, and the man currently leading the polls for the upcoming gubernatorial election. The press was already camped out in the lobby. The hospital board members were pacing the observation deck. "Aortic root replacement," Elara whispered, "with valve sparing." Jenkins looked at her eyebrows, raising slightly. "You read the file?" "I memorized it," Elara said quietly. "She has Marfan syndrome. Her tissue is going to be like wet tissue paper. One wrong stitch, and she bleeds out." Jenkins softened just a fraction. "Good. Keep that focus. Thorne is in a mood today. I heard he fired a resident in the elevator this morning for breathing too loud." Elara scrubbed her hands, the bristly brush scouring her skin, but her mind was already in the OR. She had a secret one that wasn't on her agency resume. She wasn't just a rookie nurse. Years ago, in a dusty field hospital in a conflict zone where her father had served as a volunteer medic, she had seen things that would make St. Jude's doctors vomit. She knew trauma. She knew blood. But she didn't know the politics of high society medicine. The doors hissed open. Operating Room 3 was a spaceship of chrome and blue light. The heart-lung bypass machine stood in the corner like a silent sentinel, waiting to take over the job of keeping Juliana Sterling alive. And there he was. Dr. Alistair Thorne stood by the light box, studying the MRI scans. He was tall, with silvering hair at the temples, and a face that could have been carved from granite. He didn't look up when the nurses entered. He radiated an intensity that sucked the oxygen out of the room. He was a legend, a deity. But as Alara moved to the instrument tray, counting the clamps and retractors, she glanced at the surgeon. He was holding his hands up, waiting to be gloved. Alara paused. It was subtle. So subtle that Jenkins, busy adjusting the lights, missed it. The anesthesiologist, Dr. Rahul Gupta, was busy calibrating his gas levels and missed it too. Dr. Thorne's left index finger was twitching. It wasn't a tremor of age, he was only 48. It was a rhythmic spasms, tick. Thorne stared at his own hand with a look of pure, unadulterated hatred. He closed his fist, tight knuckles turning white, then opened it. The twitch was gone. He turned his head, and for a split second, his ice-blue eyes locked with Alara's. He saw her watching. His eyes narrowed a flash of danger. "Who is this?" Thorne's voice was a low baritone, smooth but cutting. Jenkins rushed forward with a sterile gown. "This is Nurse Vance, doctor. She's filling in for Peters." Thorne let Jenkins slide the gown over his shoulders, but he didn't break eye contact with Alara. "A traveler. Wonderful. Just what I need on a Sterling case. A tourist. I've scrubbed on thoracic cases before, doctor." Alara said, her voice steady, despite her racing heart. Thorne scoffed a dry, humorless sound. "Scrubbing on a bypass in a community clinic is not the same as this nurse. Do not speak unless spoken to. Do not drift. And for the love of God, do not touch my table unless ordered." "Yes, doctor." "Let's get started," Thorne announced to the room, though his voice lacked its usual commanding boom. It sounded strained. "Scalpel." As the cold steel passed from the lead scrub nurse to Thorne's gloved hand, Alara watched his left hand, the one that was supposed to hold the delicate tissues of a senator's daughter together. It was still, for now. But Alara had an instinct honed by the sound of mortar shells and the silence of the triage tent. The air in the room felt heavy, charged with static. Something was wrong with the god in the glass tower, and they were about to cut open a girl whose father could destroy the hospital with a phone call. The surgery began with the deceptive calm of a well-rehearsed symphony. The chest was opened, the sternum sawed through with a grinding whine that vibrated in Alara's teeth. The smell of burning bone dust, usually sickening to rookies, didn't make her flinch. She was focused on the rhythm. "Retractor," Thorne commanded. The resident, a nervous young man named Dr. Evans, placed the retractor. "Too deep, you idiot," Thorne hissed. "You want to bruise the lung. Adjust. Gently." Evans paled and adjusted. Thorne was riding him hard, harder than usual. The atmosphere in the room was toxic. Thorne was moving fast, too fast. He was dissecting the adhesions around the heart with aggressive slashing movements. Dr. Gupta." The anesthesiologist spoke up from behind the drape. "BP is fluctuating. Heart rate is irritable. Can we slow down the dissection?" "Her pressure is fine, Gupta. Do your job and let me do mine." Thorne snapped, not looking up. Alara stood by the back table, organizing the sutures. She watched Thorne's body language. He was sweating, not the usual perspiration of physical exertion under hot lights, but a cold, clammy sheen on his forehead. His shoulders were hunched tight up to his ears. He was terrified. Why, Alara wondered. He's done 1,000 of these. They reached the critical stage. They had to cannulate the aorta, insert the tubes that would divert the blood to the bypass machine so they could stop the heart and work on it. "Prepare for cannulation," Thorne said. "Give me the aortic cannula." 24. French. The lead scrub nurse, Brenda, handed him the device. Thorne took it. He looked at the aorta. It was aneurysmal, swollen like a balloon ready to pop. The tissue was thin, translucent, and angry red. Thorne reached in. He needed to make a purse string suture, a circle of thread that would tighten around the tube to prevent leaking. It required absolute precision. He positioned the needle holder. Alara saw it again. The twitch. This time, it was violent. His left hand jerked just a millimeter. But in microsurgery, a millimeter is a mile. The needle tip grazed the surface of the aorta, not puncturing, but scratching the fragile, paper-thin wall. Thorne froze. He pulled his hand back as if burned. "Doctor?" Evans asked, confused. "Quiet!" Thorne roared. The outburst was so loud everyone jumped. Even the circulating nurse stopped typing at the computer. Thorne took a breath. A ragged, shuddering breath. The tissue was more friable than the scans indicated. "We knew it was Marfan, sir," Evans said tentatively. "I know what it is," Thorne yelled. He closed his eyes for a second. Under the mask, Alara could see his jaw working furiously. He was fighting something internal, a battle no one else could see. "Let's proceed," Thorne said, his voice dropping to a whisper. He went in again. He placed the stitch. It was sloppy, shockingly sloppy for Alistair Thorne. The spacing was uneven, but it held. They got the cannula in. "Go on bypass," Thorne ordered. "Going on bypass," the perfusionist echoed. "Down on flow. Heart is emptying." The rhythmic whoosh whoosh of the heart monitor slowed, then stopped, replaced by the high-pitched whine of the machine. The heart sat still in the chest, a deflated, lifeless lump of muscle. Now the real work began. They had to cut out the aneurysm and replace it with a synthetic tube, all while preserving the delicate valve leaflets. Thorne picked up the shears. He cut into the aorta. "Suction," he barked. Evans suctioned the blood away. The valve was exposed. "It's a mess," Thorne muttered. "Look at that calcification. It wasn't on the echo." He began to trim the diseased tissue away from the valve. This was the artistry. This was where Thorne was supposed to be, a god. But the god was crumbling. Alara watched as Thorne picked up a pair of fine forceps. He reached for a leaflet of the valve. His hand began to shake. Not a twitch this time, a tremor, visible to everyone. "Dr. Thorne," Brenda, the lead nurse, whispered. "Are you all right?" Thorne didn't answer. He stared at his shaking hand. He tried to steady it against the patient's sternum, but the vibration traveled down the instrument. If he touched the valve now, he would shred it. If he shredded the valve, they would have to replace it with a mechanical one. Juliana Sterling would be on blood thinners for the rest of her life. Her political father would sue the hospital into oblivion. Thorne choked out. "I need a moment." He stepped back from the table. Hands held up, trembling uncontrollably. "Doctor, the cross-clamp time is ticking," Gupta warned, his voice rising in alarm. "We have 90 minutes before ischemic damage starts." "I said give me a moment," Thorne shouted, turning his back to the patient. He walked to the corner of the room, breathing heavily. The OR fell into a terrified silence. The team looked at each other. This had never happened. The chief of surgery was having a breakdown in the middle of a procedure. Dr. Evans looked like he was about to faint. "What do we do?" "We can't leave the heart open like this." "He'll come back," Brenda said, though she sounded unsure. "He just needs to compose himself." 1 minute passed, then 2. "Dr. Thorne," Gupta called out sternly. "Her pressures on the pump are dropping. We need to move." Thorne didn't turn around. He was leaning his forehead against the cool tile of the wall. Elara, from her position in the back, saw his shoulders heaving. He was hyperventilating. Then the monitor alarm blared. A sharp red warning. "Line pressure high," the perfusionist shouted. "We have a dissection. The cannula has shifted." Chaos erupted. Because Thorne had placed the purse string suture poorly, the tube feeding blood to Juliana's body had slipped. It was tearing the aorta further, ripping backward. Blood began to pool rapidly in the chest cavity, dark and fast. "We're losing volume," Gupta screamed. "Evans, fix the cannula." I can't," Evans stammered, his hands shaking as he reached into the chest. "I can't see the tear. There's too much blood." "Thorne." "Get back here," Gupta yelled. Thorne turned around. His face was a mask of sheer horror. His eyes were wide, pupils dilated. He looked at the blood, filling the chest, the alarms screaming, the life draining out of the girl. And he did nothing. He stood there, paralyzed by a ghost from his past, watching the disaster unfold like a spectator at a car crash. He's in shock, Elara realized. The realization hit her with the force of a physical blow. He isn't going to move. "Suction, I need suction," Evans cried, flailing blindly in the chest. "I'm going to clamp it." "No," Elara shouted. The room froze. A rookie nurse never yells. "If you clamp blindly, you'll crush the coronary artery," Elara said, her voice cutting through the panic. She stepped forward, bypassing the stunned Brenda. "You'll kill the heart permanently." "Who the hell are you?" Evans yelled, sweat dripping into his mask. "Stay back." "Dr. Thorne is compromised," Elara said, her eyes hard steel. She looked at the chief surgeon, who was still frozen against the wall. "Dr. Thorne, we need orders." Nothing. The monitor was screaming. "Beep, beep, beep, beep." "She has 2 minutes of reserve volume," the perfusionist yelled. "After that, air enters the line and she strokes out." Elara looked at the table. She looked at the terrified resident who was about to kill the patient. She looked at the frozen legend. She remembered the field hospital, the shrapnel wound in the soldier's chest, the way her father had guided her hands when there were no doctors left. See the flow. Stop the flow. Elara Vance didn't ask for permission. She stepped up to the table, hip-checked the lead scrub nurse out of the way, and grabbed the long DeBakey forceps. "Nurse, what are you doing?" Gupta shouted. "You are not licensed to touch the field." "Someone has to," Elara said. She reached into the pool of blood. She didn't panic. To her, the blood wasn't horror. It was just a fluid that was in the wrong place. She used the suction tip in her left hand to clear the view, her eyes scanning the torn tissue. There. The tear was posterior, hidden behind the flap of the aneurysm. "Evans, hold the retractor here," she ordered. Her voice wasn't a question. It was a command. Evans was so shocked, he obeyed instinctively. He pulled the tissue back. Elara saw the tear. It was pumping blood into the pericardial well. She reached in with the forceps, found the lip of the torn aorta, and pinched it shut. The flooding stopped. The room went silent, save for the hum of the machine. Elara looked up, her hand deep in the patient's chest, holding the girl's life between two pieces of steel. She looked directly at Dr. Evans. "I have the tear controlled, but I can't suture it. I'm a nurse." She turned her head, her gaze locking onto the frozen figure in the corner. "Dr. Thorne," she shouted, dropping the honorifics. "I have the bleed. Get your ass to this table and sew it, or tell the senator why his daughter is dead." The silence following Alara's shout was heavier than the lead aprons they wore. It wasn't just quiet. It was the vacuum of a hierarchy collapsing. A travel nurse had just sworn at the chief of cardiothoracic surgery. In any other timeline, security would be escorting her out. But in this timeline, Juliana Sterling was bleeding out. Dr. Alistair Thorne blinked. The fog of panic that had enveloped him, a thick grey static born of a memory he had buried for 20 years, fractured at the sound of Alara's voice. "Get your ass to this table." It was the kind of raw, guttural command he hadn't heard since his residency in the trauma pits of Chicago. He pushed off the wall. His legs felt like wood, but they moved. He walked back to the operating table, his eyes locked not on the patient, but on Alara's hands. They were rock steady. She was deep in the chest cavity, her fingers obscured by blood, and retractors pinching the tear in the ascending aorta. She wasn't trembling. She was breathing in a slow, rhythmic cadence. Thorne stepped up beside her. "Dr. Evans." He rasped his voice, sounding like it was coming from a crushed throat. "Suction. Clear the field around her fingers." Evans' shaking moved the suction tip. The blood cleared. "I have the intimal tear," Alara said, her eyes never leaving the wound. "It's jagged, about 2 centimeters. If I let go, the pressure will dissect the coronary ostia, and she dies." Thorne looked at the tear. It was a nightmare scenario. The tissue was shredding. To fix this, he needed to sew a patch over the tear, while the heart was still partially full, then get the cannula back in to drain it. It required the dexterity of a watchmaker. Give me a 4-0 Proline on a Castroviejo driver," Thorne ordered. Brenda slapped the instrument into his palm. Thorne raised the needle. He looked at the tear. He looked at Alara's fingers holding the dam against the flood. He brought the needle tip down, and then it happened again. The tremor returned with a vengeance. His hand vibrated so violently that the needle tip blurred. He tried to force it, still his forearm muscles bulging with the effort, but it was like trying to hold back an earthquake. He couldn't thread the needle through the fragile tissue. He would tear it to pieces. Thorne gasped. "I can't." "What do you mean you can't?" Evans squeaked. "My hand," Thorne whispered, staring at it in horror. "It won't stop." "Dr. Gupta," Alara said, her voice dropping to a low, intense register. "How much volume do we have left?" "Critically low," the anesthesiologist replied, his voice tight. "Maybe 45 seconds before cardiac arrest." Alara looked at Thorne. She saw the defeat in his eyes. The god of the scalpel was broken. But she couldn't do the stitching. She knew anatomy, she knew trauma, but she didn't have the years of muscle memory to perform a complex aortic arch reconstruction. She couldn't be the surgeon, but she could be the scaffold. "Doctor," Alara said, locking eyes with him. "Look at me." Thorne looked up. "You know the motion," she said. "You know the stitch. Your brain knows it. It's just your hand that's scared." "I can't stabilize it." Thorne confessed, a tear leaking from his eye and disappearing into his mask. "I can't trust it." "Then don't trust it," Alara said. "Trust me." "What?" "Evans, step back," Alara ordered. "Dr. Thorne, put your hands over mine." That's insane, Brenda hissed. You can't suture by proxy. Shut up, Brenda, Elara snapped. Doctor, place your wrists on my wrists. I will be your anchor. I will hold the tissue. You throw the stitch. I will absorb the tremor. It was a technique she had used once in the field, helping a shaky volunteer medic sew up a scalp wound during a bombardment. But this was microsurgery on a beating heart. Thorne hesitated. Then, with 40 seconds left on the clock, he leaned in. He rested his forearms on Elara's forearms. He placed his wrists against hers. Heavy, she whispered. Rest your weight on me. Thorne slumped his weight onto her arms. Elara braced her muscles, turning her forearms into pillars of stone. The contact was electric. She could feel the vibration of his panic buzzing against her skin. But because her arms were grounded against the patient's retractor, the vibration dampened. Now, Elara commanded. Throw the stitch. Thorne took a breath. Supported by Elara's unyielding stability, the needle tip stopped dancing. It hovered steady. He flicked his wrist. The needle bit into the aorta. Yes, Elara whispered. Again. He drove the needle through. Elara, using her left hand, caught the tip with the forceps and pulled it through. They were working as one organism, Thorne providing the angle and the intent, Elara providing the stability and the retrieval. 1 stitch, 2 stitches, 3. Cannula, Thorne grunted. Evans handed the tube. Thorne guided it in his hands, still resting on Elara's. Snare, Elara said, handing him the tourniquet. They tightened it. The seal held. Go on bypass, Thorne ordered. Full flow, the perfusionist announced. We are capturing. Pressures stabilizing. The room exhaled. It was a collective release of breath that sounded like a tire deflating. The immediate threat of death was over. The machine had the blood. The heart could be stopped. Thorne pulled his hands away from Elara's as if he had been burned. He stepped back, clutching his chest. We have the tear contained, he stammered to the room. We proceed with the root replacement. He looked at Elara. For a second, the mask of the arrogant surgeon slipped, and she saw a man who was utterly lost. I can't finish this, he whispered to her, so low only she could hear. The adrenaline is gone. I'm going to crash. Elara looked at the clock. They were 2 hours into a 6-hour surgery. The hardest part, rebuilding the valve, was just starting. If he left now, the hospital would be ruined. If he stayed and failed, the girl died. No, you're not, Elara whispered back, stepping closer to him. You don't get to crash, not while she's open. You are going to finish this surgery, Dr. Thorne. I can't steady my hands without... He gestured to their joined arms. Then we don't stop, Elara said. I'm scrubbing in as your first assist. Evans, you're demoted to second. Move. You can't do that, Evans protested. She's a nurse. I don't care if she's the janitor, Thorne said, his voice suddenly hardening, regaining a sliver of his old steel. She's the only reason this patient isn't in the morgue. Nurse Vance, scrub in. We have a valve to save. The next 4 hours were a hallucination. Operating room 3 became a sealed vessel cut off from the laws of the outside world. To the observation deck above, where the blinds were drawn, it would have looked like a standard procedure. But inside the room, a secret pact was being forged in blood and titanium. Elara stood at Thorne's right hand, the position reserved for the senior fellow. She didn't just hand instruments. She was physically part of the operation. Every time Thorne had to do fine work, trimming the scallop of the valve, suturing the coronary buttons, he would hesitate. The tremor would start a hummingbird wing beat in his fingers. and every time Elara was there, she would shift her position, placing her hand gently against his forearm, or using a retractor to create a bridge for him to rest his pinky finger on. It was a dance of touch. She learned his tells. A twitch of the eyebrow meant he was losing focus. A shallow breath meant the panic was rising. "Breathe, doctor," she would murmur. 30-proline, left coronary button. You've done this 1,000 times. 1,000 times, he repeated like a mantra. The staff watched in stunned silence. Jenkins, the head nurse, kept passing instruments, her face unreadable. She knew this was career suicide for all of them, if it got out. A nurse effectively guiding the surgeon's hands. It was malpractice. It was madness. But it was working. The synthetic graft was sewn into place. The patient's own valve was suspended inside the tube, a procedure known as the David V. It was the Mount Everest of cardiac surgery. "We're ready to reimplant the coronaries," Thorne said. This was the moment of truth. If these tiny arteries were twisted or kinked, the heart would have a massive attack the moment they woke it up. Thorne's hands were sweating inside his gloves. He paused over the right coronary artery. It's too small," Thorne whispered. "I can't see the lumen clearly." Elara leaned in. She didn't have Loop's magnifying glasses like he did, but she had youth and eyes that had spotted snipers in tree lines. "It's not too small," she said. "The angle is wrong. Evans, rotate the table 5 degrees to the left." The table whirred. The angle shifted. "There," Elara said. "See the opening, oh?" "I see it," Thorne said. He took the needle. His hand shook. Elara reached out, not touching him this time, but hovering her hand just below his. "I'm right here. If you fall, I catch you." Thorne exhaled. He drove the needle home. Perfect placement. As they began the final closure of the aorta, the atmosphere shifted from panic to a strange, sacred exhaustion. They had done the impossible. They had navigated the storm. "Coming off bypass," Thorne announced. His voice was stronger now. The finishing line was in sight. "Warming the patient," the perfusionist said. "Clamp coming off." Thorne removed the cross clamp. This was the moment. Blood, warm and oxygenated, rushed back into the reconstructed heart. They waited. The heart was a motionless lump. "Come on," Elara whispered. "Beat." Nothing. "Fibrillation," Gupta noted. "Heart is quivering, charging paddles to 10 joules. "Clear," Thorne said. Thump! The body jerked. The monitor line went flat, and then spiked. Ba-bump. Ba-bump. A sinus rhythm. Strong. Beautiful. "We have a heartbeat," Gupta announced, sounding like he might cry. "Pressures are 110/70. Perfect. My God, it's perfect." Thorne dropped his hands to his sides. He didn't cheer. He didn't smile. He just slumped. The adrenaline crash he had been holding off finally hit him. "Close up," Thorne said, his voice hollow. "Evans, close the chest. Subcuticular stitches on the skin. Make it pretty for the senator." "You're leaving, sir?" Evans asked. "I need air," Thorne said. He ripped his gown off before he even left the sterile field, tossing it into the bin. He stripped his gloves, throwing them on the floor. He didn't look at the team. He didn't look at the patient. He stopped at the door and turned back. His eyes found Elara. For a moment she thought he might thank her. He might acknowledge that she had just saved his reputation and the girl's life. "Nurse Vance," he said coldly, Yes, doctor. Report to my office immediately after the count. We need to discuss your insubordination during the procedure. The doors hissed shut behind him. The room went dead silent. Did he just... Evans trailed off, staring at the door. Did he just write you up? Elara stood there, her hands still covered in the blood of the senator's daughter. She felt a cold knot form in her stomach. She had expected gratitude, maybe silence. But this he's going to fire me, Elara realized. He's going to fire me to cover his tracks. Jenkins walked over and ripped the suction tip out of Elara's hand, though not unkindly. Vance, scrub out. I'll finish the count. Sarah, Go, Jenkins said, her eyes hard but sympathetic. If he's calling you to the tower, you need to have your story straight, because if he throws you under the bus, you'll never work in medicine again. Elara walked to the sink. She looked at herself in the mirror. She looked the same as she had 6 hours ago, but her eyes were different. They were older. She washed the blood off her arms. The water swirled pink in the drain. She had saved the god, and now the god was coming for her. Dr. Thorne's office was less a workspace and more a museum dedicated to his own ego. It sat on the top floor of the surgical wing, with floor-to-ceiling windows overlooking the Manhattan skyline. Awards lined the walls in mahogany frames. Elara knocked on the heavy oak door. Enter! Thorne's voice came through muffled. She pushed the door open. Thorne was standing by the window staring out at the grey city. He had changed into a crisp, tailored suit, looking every inch the wealthy, untouchable surgeon. But Elara noticed the glass of scotch in his hand. It was 11:20 a.m. Close the door, he said, not turning around. Elara closed it. The latch clicked with a sound like a prison lock. Do you know why I called you here, Ms. Vance? To fire me, Elara said, standing straight. She refused to cower. She had held a dying heart in her hands. She wasn't going to be intimidated by a man in a suit. Thorne turned. His face was concerned, but his eyes were bloodshot. I should. What you did in there was reckless. You exceeded your scope of practice. You touched a sterile field without a license. You barked orders at an attending surgeon. In legal terms, you committed assault and battery on a patient. In medical terms, I saved her life, Elara countered. And yours? Thorne's jaw tightened. You think you saved my life? I saved your reputation, Elara said, stepping forward. If that girl had died on the table because you froze, Sterling would have buried you. You'd be testifying in front of a medical board for the next 10 years. Thorne slammed his glass down on the desk. The amber liquid sloshed over the rim. You have no idea what you're talking about. Don't I? Elara challenged. I saw your hand, Dr. Thorne. That wasn't fatigue. That was a tremor. You have a psychological block. And judging by the date... She glanced at the calendar on his desk. It was November the 14th. The date was circled in red ink. Thorne followed her gaze. He went pale. Who told you? He whispered. Nobody told me, Elara said. I guessed. You froze when the aorta tore. You froze when you saw the blood pooling. You were reliving something. Thorne sank into his leather chair. The fight seemed to drain out of him all at once. He looked suddenly old. Her name was Sarah, Thorne said, his voice barely audible. My niece. My sister's only child. Elara stayed silent, letting him speak. 20 years ago today, Thorne continued, staring at his hands. She was 7. Car accident. Aortic rupture. I was the on-call resident. I was the only one there who could operate. He laughed bitterly. I was arrogant. I thought I was a god even then. I opened her up. But I wasn't fast enough. She bled out in my hands. I felt her heart stop against my palm. He looked up at Alara, his eyes wet. When Juliana's aorta tore, it was the same sound, the same smell. I was back in that trauma bay. I couldn't move. I couldn't breathe. But you finished the surgery today, Alara said softly. No. Thorne shook his head. We finished it. You became my hands. He looked at her with a strange expression, half resentment, half awe. I have never seen a nurse with your instincts. Where did you learn to anticipate a surgeon like that? Aleppo, Alara said. 2018. My father ran a field clinic. We didn't have CT scans or bypass machines. We had ketamine and prayers. I learned to read the surgeon because if I didn't, the patient died. I learned that titles don't matter when the blood is running. Thorne studied her. You're wasted as a traveler, Vance. Is that why you're firing me? Thorne sighed. He reached into his drawer and pulled out a file. Her agency contract. I called the agency, Thorne said. Alara braced herself. I told them that your contract is terminated effective immediately, Thorne said. Alara felt the sting of tears. She nodded, turning to the door. Fine. I'll clear out my locker. Sit down, Alara, Thorne commanded. She stopped. He had used her first name. I terminated your agency contract, Thorne said, sliding a different document across the desk. Because I'm hiring you. St. Jude's staff. Lead nurse for the cardiothoracic wing. Alara stared at the paper. It was a permanent contract. The salary was triple what she was making. I need you. Thorne admitted the words tasting like ash in his mouth. My hands. They aren't what they used to be. The tremor comes and goes. I can manage it usually. But today proved I can't do it alone on the big cases. I need a second who understands. Someone who can cover for me. You want me to be your crutch, Alara said slowly. I want you to be my partner, Thorne corrected. But understand this, the world sees Alistair Thorne the genius. They can never know about the tremor. They can never know what happened in that room today. You take the job, you take the secret to your grave. Alara looked at the contract. It was everything she had worked for. Security, respect, a chance to save lives at the highest level. But it was built on a lie. And if I refuse, then you walk out that door, Thorne said, and I will make sure you never scrub in a Tier 1 hospital again. I still have that much power. It was a threat wrapped in a job offer, a golden handcuff. Alara picked up the pen. She thought of the patients. She thought of the adrenaline of the OR. She thought of Juliana Sterling alive because of their combined sin. She signed. Welcome to St. Jude's, Thorne said, taking the paper back. Now get out. The senator is here. The recovery wing was swarming with suits. Secret Service agents stood by the elevators, and the hallway smelled of expensive lilies. Alara walked toward the nurse's station, wearing her new badge. It felt heavy. The other nurses whispered as she passed. They knew something had happened in OR3. Rumors of shouting of panic, but no one knew the truth. Vance, Jenkins hissed, pulling her into the linen closet. What happened? You were in there for 20 minutes. I got a promotion, Alara said flatly. Jenkins' jaw dropped. You... What? After screaming at him. Don't ask Sarah, please. Just then a commotion erupted down the hall. A phalanx of people was moving toward Juliana's room. At the center was Senator Marcus Sterling. He was a tall man with a politician's smile and eyes that missed nothing. Beside him walked Dr. Thorne, looking recovered, confident, and heroic. "Ah, there she is," Thorne announced, spotting Alara. The group stopped. The senator turned his gaze to Alara. "This is the nurse I was telling you about," Thorne said, placing a hand on Alara's shoulder. "Alara Vance. She was instrumental in the procedure." Alara stiffened. Was he going to tell the truth? "She managed the bypass machine with exceptional skill," Thorne lied smoothly. "Kept the team organized while I performed the reconstruction." The senator stepped forward and extended a hand. "Thank you, Ms. Vance. Alistair tells me it was a complicated surgery. My daughter, she means everything to me." "She's a fighter, sir," Alara said, shaking his hand. It was warm and dry. "She's doing well." "She is," the senator said. "She's awake, and she's asking for you." Alara froze. "Me?" "She said she remembers a voice," the senator said, tilting his head. "She said she was floating in the dark, and she heard a woman's voice telling her not to die. She thinks it was an angel. I suspect it was you." Thorne's hand tightened slightly on Alara's shoulder. "A warning." I spoke to her before the anesthesia took hold," Alara improvised. "I just told her we would take care of her." "Well, whatever you said, it worked," the senator beamed. "Alistair, I want a picture with the team that saved my girl." A photographer materialized. Thorne stood on one side of the senator, looking regal. He gestured for Alara to stand on the other side. "Smile, everyone." The flash blinded Alara. In that white burst of light, she felt the trap closing. She was now part of the brand, the savior team. If the truth about Thorne's incompetence ever came out now, it would take down the senator, the hospital, and her. "Dr. Thorne," a reporter from the Times shouted from the back of the pack. "Is it true that this was the first time the David Fee procedure was performed on a patient with such advanced Marfan's?" "It was a calculated risk," Thorne said, stepping into the spotlight, leaving Alara in the shadow. "But when you have the experience, you know when to push the boundaries of medicine." Alara watched him. He was performing again. The tremor was gone, replaced by the swagger of the god. She turned to leave, feeling sick when a young resident Dr. Evans bumped into her. "Congratulations on the promotion," Evans muttered. His voice was laced with venom. "Evans, Don't," he spat. "I saw what happened. I saw you holding his hands. I saw him freeze." Alara's blood ran cold. "Evans, keep your voice down." "Why should I?" Evans sneered. "He demoted me. I'm off the rotation. He blamed me for the cannula slipping. He told the board I panicked." "He what?" Alara asked, shocked. "He needed a scapegoat for the mess in the chart." Evans said, his eyes wild. "So he sacrificed me, and he bought you off with a promotion." "I didn't know," Alara said. "You took the money," Evans said. "You're just like him, now." He walked away, leaving Alara standing alone in the hallway. She looked back at Thorne, who was laughing at something the senator said. He had destroyed a young doctor's career to protect his secret, and he had made Alara his accomplice. She walked to the window of the recovery ward. Inside, Juliana Sterling was sleeping a maze of tubes connecting her to life. She was alive. That was the only thing that mattered. "Isn't it?" Her phone buzzed in her pocket. It was a text from an unknown number. She opened it. It was a video file. Her heart hammered against her ribs. She pressed play. The video was grainy shot from a weird angle, likely a phone hidden in a scrub pocket or a smart glass recording. It showed the OR. It showed Thorn backed against the wall, shaking. It showed Ilara's hands deep in the chest. It showed her screaming at him. "I have the bleed. Get your ass to this table." The text message below the video read, "The god of the scalpel is a fraud. I wonder what the senator would pay for this. Or should I just upload it to YouTube?" Ilara looked up. Dr. Evans was at the end of the hall, holding his phone up, staring at her with a look of pure, destructive triumph. The hero nurse had saved the patient, but she had just started a war. The phone in Ilara's hand felt like a grenade with the pin pulled. On the screen, the frozen image of her screaming at Dr. Thorne mocked her. Dr. Evans stood 10 feet away, his face twisted in a mixture of fear and vindictive triumph. He was shaking just like Thorne had been. "You can't do this, Evans," Ilara said, her voice low. "Think about the fallout. You release this, the Sterling family sues St. Jude's into bankruptcy. The heart transplant program closes. Hundreds of patients on the waiting list, they'll have nowhere to go. You won't just destroy Thorne. You'll burn the whole hospital down." "I don't care," Evans hissed, stepping closer. "He destroyed my life. He marked my file. I'll never get a fellowship. If I'm going down, I'm taking the god with me." "And what about me?" Ilara asked. "You take him down. I go down for practicing without a license. I go to jail, Evans." Evans hesitated. He looked at Ilara, the woman who had saved the patient. He couldn't. I don't want to hurt you, Ilara. But your collateral damage. Unless what? "Unless you testify against him," Evans said. "Go to the board. Tell them he froze. Tell them he forced you to scrub in. Corroborate the video. If you turn whistleblower, they'll grant you immunity. We can end him together." It was a seductive offer. It was the right thing to do. Expose the arrogance. Expose the danger. Ilara looked at the video again. Then she looked down the hall, where Juliana Sterling lay sleeping. If this went public, Juliana would wake up to find out her surgery was a botched horror show, saved by a nurse. The stress could kill her. The scandal would taint her father's election. Ilara made her choice. "Send me the video," Ilara said, "and delete your copy." Evans laughed a harsh bark. "You think I'm stupid? This is my leverage." "No," Ilara said, walking up to him until they were toe-to-toe. "This is your suicide note. You post that, and Thorne's lawyers will destroy you before the video even buffers. They'll claim it's a deep fake. They'll claim you doctored it because you were disgruntled about being fired. They have millions. You have an iPhone and a grudge." Evans's confidence faltered. "So what do I do? You come with me," Ilara said, grabbing his arm. "We're going to the tower." Dr. Thorne was pouring another scotch when the door to his office opened without a knock. He spun around, ready to berate his secretary, but stopped when he saw Ilara and Evans. "Get him out of here," Thorne snarled, pointing at Evans. "I already called security." "Security isn't coming," Ilara said, locking the door. "And you're going to listen." She took her phone out and placed it on his mahogany desk. She pressed play. Thorne watched the video in silence. The color drained from his face, leaving it the shade of old parchment. He saw himself cowering. He saw the truth laid bare. "How much?" Thorne whispered, looking at Evans. "How much do you want?" "I don't want your money," Evans spat. "I want my career back. I want you to admit you lied." Thorne sneered. "I am Alistair Thorne. My word against a failed resident. I'll crush you." "And what about my word?" Elara interjected. Thorne looked at her, betrayed. "You signed a contract." "Contracts don't cover perjury," Elara said. "If Evans releases this, I won't deny it. I'll confirm everything. The tremor, the freeze, the ghost surgery." The room fell into a heavy, suffocating silence. The city lights of New York twinkled indifferently outside the glass. The god of the scalpel was trapped between a nurse and a student. "So," Thorne said, sinking into his chair, "it's over." "It doesn't have to be," Elara said. She had been formulating a plan on the elevator ride up, a way to save everyone except the ego. "Here are the terms." Elara stated, her voice commanding the room just as it had in the OR. "1. Dr. Evans is reinstated immediately. His record is scrubbed. He gets a transfer to Mount Sinai with a glowing letter of recommendation from you. He leaves St. Jude's, but his career is saved." Evans looked at her, surprised. He nodded slowly. "Deal." 2. Elara continued, turning to Thorne. "You announce your retirement, effective next month." "Retirement?" Thorne slammed his fist on the desk. "I am in my prime. I have 10 years left." "You have a tremor," Elara shouted back. "You have PT, and today we got lucky. Next time you'll kill someone, and I won't be there to hold your hand." Thorne stared at his hands. They were trembling again. "You don't have to go out in disgrace." Elara softened her tone. "We spin it. You're stepping down to focus on research and teaching. You become emeritus. You keep your legacy. The video disappears. Evans gets his life back. Juliana Sterling never knows." Thorne looked at the view one last time. He looked at the empire he had built. He knew she was right. The crack in the armor was too big to patch. "And you?" Thorne asked, looking at Elara. "What do you get out of this? You're just a nurse." Elara smiled, a sad, wise smile. "I'm the nurse who saved your life, Doctor. That's enough for me." Thorne picked up his pen. He wrote a note on a prescription pad. "Transfer order for Dr. Evans. Letter of rec to follow." He handed it to Evans. "Get out of my sight," Thorne whispered. Evans took the paper. He looked at Elara, nodded a silent thank you, and left the room. The press conference 2 weeks later was a somber, dignified affair. Dr. Alistair Thorne, the hero who had saved the senator's daughter, announced he was stepping down from surgery to lead the St. Jude's Research Institute. The press called it a loss for the medical world. Elara stood in the back of the room watching. She hadn't taken the job as head nurse. She realized she couldn't stay at St. Jude's. The walls knew too much. She had resigned the day after the surgery. As the cameras flashed, Thorne spotted her in the crowd. He paused mid-speech. For a second, the arrogance dropped. He gave her a nearly imperceptible nod, a salute from one soldier to another. Elara turned and walked out of the hospital doors into the cool autumn air. She didn't know where she was going next. Maybe another war zone. Maybe back to school to get the MD behind her name so she wouldn't have to hide next time. She pulled her phone out. The video file was still there. She hovered her thumb over the delete button. She thought about the power it held. She thought about the lie. Then she pressed delete. The screen went black. Elara Vance adjusted her coat, took a deep breath, and walked into the crowd, anonymous once again. A hero that nobody knew, carrying a secret that would never be told. Until now. And that is the incredible, untold story of Elara Vance. In a world obsessed with titles and prestige, it was the person with the lowest rank in the room who held the highest responsibility. It makes you wonder how many other heroes are walking the halls of our hospitals, invisible, saving lives in the shadows, while the gods take the credit. If this story had you on the edge of your seat, please hit that like button. It really helps the channel grow and lets me know you want more real-life medical dramas like this one. And I want to know what you think. Did Elara do the right thing by deleting the video and letting Dr. Thorne retire with his dignity? Or should she have exposed him to the world? Let me know your verdict in the comments down below. Don't forget to subscribe and ring the bell so you never miss a story. I'll see you in the next video.